Hi, my name is Charles James. I am President and CEO of North American Healthcare Management, and I'm proud to announce that I am now the Executive Director of the Rural Advantage, an accountable care organization for RHCs and FQHCs. At the Rural Advantage, our mission is clear: provider and patient well-being. We put providers first because we recognized, especially during the pandemic, our providers were not well. Understaffed, margins are shrinking. The only way to increase revenue is to see more patients, and that hasn't been possible for many of us. That's why we created the Rural Advantage. Our objective is to return value to our providers, the ones providing the care. Many ACOs are wonderful organizations with great success. Many of our ACOs, however, do not know what to do with rural health clinics. There's a lot of talk about value-based care, and it's the latest and greatest, but without knowing about rural health clinics, it's hard to adequately return value to them. That's why we're here. Many of you hopefully know North American and the work we've done with rural health clinics and FQHCs over the years. My business partner and I, David James, our CFO, and the rest of our team have significant expertise in all aspects of rural health clinic and FQHC reimbursement. Our medical director is Dr. Tom Davis. Dr. Davis and North American worked together once upon a time, probably 3 lifetimes ago, at Patients First Healthcare in Central Missouri, a group of rural health clinics that was sold based on their value-based contracts. Dr. Davis led that charge. Now Dr. Davis is helping us communicate with our providers about how we need to code and how we can increase the value being returned to us via Medicare shared savings. Pinnacle and Kelly Conroy's team are doing for our ACO what North American does for rural health clinics. They're coming in, help us with the application, help us with our infrastructure, help us with policies and procedures, and help guide us through all of the mechanisms that we will need for our providers to demonstrate value, to achieve Medicare shared savings. Pinnacle is our administrative team. Pinnacle's been in this workspace in the value-based care arena for many, many years and has had great success. They're bringing their expertise to us. I say that the tools we'll use are simple, but it's of course how we use these tools and how we document our patients' disease burden while providing care management services, annual wellness visits, preventive screenings, transitional care management, and generally keeping the patient out of the hospital. Many of you may be providing some of these services already. Some of you may not be. Some of you may not think you can do it. Those of you that don't think you can do it, we're here for you. You can do it. We're talking about progress, not perfection. So we're going to increase utilization of these tools, and we're here to help our providers do that. Fairly simple tools. Again, it's how we use them and how we document our care. The Rural Advantage has a 75-25 split. Part of what we do at the Rural Advantage is we are pushing patient quality data to the desktop of our providers via a product called LightBeam, so that our providers know their patient's disease burden before they're seeing them, so that we can be sure and address those issues during care management services and annual wellness visits. 25% of savings comes to the ACO for running the program. 75% is returned to our providers. That's our split. We are applying for Medicare Shared Savings. Medicare Shared Savings has no downside risk. We're applying for Track A, where the savings rate is 40%. We see a shared loss rate of 0%. That means there's no downside risk. That means at no time will we come back to you and say, hey, you didn't achieve your goals, pay money in. There is no downside risk. There's no cost to get in. There's no time that this reconciles like an RHC cost report. Downside risk is when we get further down the spectrum of value-based care and start assuming risk after we've achieved a degree of savings that we probably can't get any more out of. Start with Medicare Shared Savings and we proceed to take on more risk. This initial step has no downside risk, no cost to get in. We're enrolling participants. Please contact me. We would love to sign you up and get started. What we'll do is we'll come in and do a risk assessment, do an operational assessment, look up your provider NPIs, and see what kind of savings we think we can achieve for you. Please come with us. If you're already with an ACO and happy, we're not for you. If you're with an ACO and you're not happy, you feel like you don't get attention, we are for you. If you don't feel like you're ready for value-based care, we're especially ready for you. We're here to help you get ready. This is a new delivery system. We will have to engage. Let us be your partners. Provider and patient well-being. It's simple. Please contact me. Let's talk about how we can help your organization. Charles James, 314-560-0098. I'd love to speak with you. The Rural Advantage, provider and patient well-being is our mission. Thank you.